Hi everyone, I'm Dr. Q. Today I have a very special guest, a good friend. He is a doctor here in NYC and he was also tested positive for COVID-19. Here you go, Graham.
Hi, thank you for having me, Q. My name is Graham. I'm an anesthesiologist here in New York. I'm originally from Chicago, went to med school in New Orleans.
So Graham, I'm just gonna try to make this quick as possible because I really appreciate your time and I know you're busy and working a lot here. Graham, when did you first hear about COVID-19 and were you worried about this virus originally?
So I believe I first heard the virus as soon as China started publicly acknowledging it back in the middle of January. As far as being worried about it initially, to be honest, I really wasn't. I remember the SARS outbreak in 2002 and how that was quickly contained. I was hoping that this would be a similar situation. Obviously, my outlook changed when we saw the high mortality rate.
Yeah, that's a great comparison because this is like a mutation of the SARS virus. So I wasn't expecting this outcome either. Were you trained or did you guys have different protocols in place?
So when the seriousness of this virus became apparent, we were all trying to mentally prepare for what was about to occur. But of course, you don't know how this is going to impact your specific community right away. So we were really flying by the seat of our pants for the first few weeks, trying to figure out which pharmaceuticals work best, what type of ventilator settings are most beneficial, the type of sedation you use, and what the impact of patient positioning had on outcomes. And despite so many hospitals and research institutions working on this problem, there were no clear guidelines to follow. So our hospital, like many others, came up with our own algorithm to treat these patients based on peer-reviewed data. And that really wasn't until about 2 weeks ago did we have this clear guideline to follow.
Yeah, it's really tough, especially when all of this stuff is unknown and everything's happening so fast. Were you apprehensive about your own health when you were treating patients?
So fortunately, I consider myself to be healthy and relatively young, so I didn't view this exposure too differently than what I normally confront on a day-to-day basis. As an anesthesiologist, we are constantly manipulating people's mouths to intubate when we're exposing ourselves to practically an unlimited amount of pathogens. So I knew that eventually I would become positive, either through direct patient contact or through another colleague. But statistically speaking, I was confident I would come out on the other side in good shape. But I'm, definitely not the majority, I think.
That leads me to my next question. How long till you felt the symptoms, or were you tested because of a colleague?
So I felt symptoms about 4 days after I was initially exposed, and the quickest I could get testing was 2 days later. So I basically got tested because I started feeling sick.
So how long did you wait to get your results then?
So the results were actually fairly quick. I got them about 8 hours after I got tested, which was unusual at the time, but I think now it's become more common.
Were you scared when the results were positive?
So I assumed I was positive from the get-go, and I was actually more relieved that it was this virus causing my symptoms and not anything else. And I've had plenty of colleagues come down with viral symptoms and have had their test results come back negative. So it was a relief to have a concrete diagnosis.
Wow. So were they false negatives, would you say, or were they retested?
That's a good question. So actually, yes, they were retested, a few of them, and they actually came back negative for a second time. But definitely there is a little bit of a high false negative rate.
I did hear about the false negative tests like in the beginning, but I'm also hearing that the tests that have been procured now, they're a lot more accurate. Is that true?
Yeah, I think, initially there was a learning curve in how to actually take the sample, and now that healthcare providers and nurses are starting to become more experienced with taking the samples, they're collecting them, I think, more accurately. And again, I think the process in which they get tested, which is a polymerase chain reaction test, is the gold standard for these types of illnesses. And, if you have a positive result, you can bet that it's a true positive.
And then what did this process feel like? When did you recover?
So I was lucky and I only had mild to moderate symptom severity. With that said, I would probably not want to repeat the experience. The first day I had fevers, chills, headache, and muscle aches. And that really lasted for about 5 days. The fever went away after only about 2 days. but I really wasn't completely 100% until about 8 days after
Wow.
symptoms.
That's a long time, though, especially for a healthy individual like you. 8 days.
Exactly, and that was what kind of concerned me. I never get sick. I have never called out sick at work ever. This was the first time I've ever called out sick. Of course, taking precaution, but 8 days again, yeah, it's a long time for anyone, and especially for someone who doesn't get sick.
So how are you feeling today? Do you have any symptoms? Have you recovered fully?
I feel like I've recovered fully, and I don't really have any residual symptoms that I can, really communicate to you. I think maybe a little bit of loss of taste, but I think that should recover.
That's great to hear, that you're pretty much fully recovered, especially because you are a friend. But also it's a little bit enlightening to hear that, okay, people are recovering from this. Not everyone is dying. So I'm just really happy to hear some good news.
Thank you.
So what was work like before this whole COVID-19 took place?
Yeah. So before and after, so right now I can definitely tell you that it's unrecognizable. After elective surgeries were canceled, the operating room time has decreased 80 to 90%. Operating rooms are now reserved for emergencies only, and those are still coming in, but we're seeing a lot less traumas since people are now avoiding public transportation and driving. And I imagine crime has also gone down quite a bit, and so we're seeing the beneficial impacts of that. But anesthesiologists work in a variety of departments normally. We work in the operating room, we run many surgical intensive care units, and we take care of floor patients when they are unable to breathe and are in cardiac arrest. So we have a surplus of anesthesiologists, and our leadership repurposed us to focus on ICU patients, which is something that we're very well trained to do. We have also doubled or tripled the amount of anesthesiologists that respond to emergency airways on the floor. So we're assisting the ER, the emergency room, in intubating patients and providing our experience with invasive procedures like central lines and arterial lines throughout the hospital. So we're really becoming an interdisciplinary department like many other departments in the hospital.
So it looks like that the hospital that you particularly work in, and from speaking with other colleagues, that you guys are really getting ready for it, and you guys are ready for the overflow in a way.
Yeah, we're doing everything we can. We're really, kind of taking the unique subspecialties into consideration when trying to manage ICU patients, and we're just repurposing a lot of people in the hospital to fit in.
I heard in certain parts of Italy, they're training other doctors like cardiologists to specialize in something of treating COVID. Are they doing that at like NYC hospitals?
Good question. Again, we're really trying to take advantage of the uniqueness of every department. The real main players here are, the emergency department, the anesthesia, internal medicine, the intensivists. So those are actually the core people taking care of those patients. Of course, we have, fellowship trained people that can come in the medicine side. We have general surgeons that are able to manage ICU patients. And in one particular hospital, they're graduating medical students early, 3 months early, so they can become interns to manage these patients. So that's should be an indicator to everybody where we're at as far as a doctor, shortage, if you will. We're trying to get all hands on deck.
Yeah, this is going to be a fight, and I'm glad to hear that, we're doing what we can to prepare for this. My next question is, do you guys have enough supplies to treat patients, or do you think you'll run out anytime soon?
So I think right now we currently have just enough, but we've gotten to that point because we started reusing personal protective equipment early on. I think we saw a deficiency and shortage coming, so we took proactive measures early by reusing masks, face shields, things like that, which aren't typically meant to be reused, but we are reusing them. And to my knowledge, there have been no adverse consequences of that up until this point, but I don't know. I think in the next couple of weeks, we'll really start to see a shortage coming.
Yeah, because for PPEs for healthcare workers, usually you guys are remasking, regloving every patient you see. So if you're not doing that, to me, that seems like there is somewhat of a shortage.
Yeah, I mean, I think again, on a day-to-day basis, especially in the OR, I'm using maybe 10 to 15 masks, which sounds like a lot, but if you think about how many patient contacts I have on a day, it really isn't. I'm going through maybe a quarter box of gloves a day. You're going through hairnets frequently, so it's definitely an adjustment.
So, do you have any messages for us and for my audience here?
Yeah, I think in the end, it's important for people not to panic. Chances are, if you contract this disease, you're going to live, but it's those with compromised immune systems and advanced age that we need to be concerned about. As healthcare providers, we deal with this level of acuity on a day-to-day basis, but it's the volume of patients that are coming in that's an issue. So we need to be very tactful on how we relax the social distancing going forward. And for the time being, everyone needs to stay at home while the hospital system flushes out the patient load that we're seeing.
Yeah, absolutely, Graham. Thank you so much for your leadership, for speaking out for other healthcare workers, and giving us an insight on what your experience was of testing positive for COVID-19. I commend you for being the real hero to put your life at risk to treat patients every day. And now you're back at it, and you're still continuing to, help fight this battle. So thank you so much.
It was a pleasure being here, and thank you so much for inviting me. And keep doing what you're doing.
Thank you, Graham.